everybody, and thank you very much to all of you for joining our ward meeting tonight. I'm Charlotte, I'm the councillor for Reddicap, and I'm just going to get the meeting going, and then I am going to take my camera off because I'm relying on 4G at the moment. So we've got a few things to cover at the moment. I'll just tell you up front, we are recording the meeting, then we've got an update from Public Health, and then we have got any other business and any urgent ward meeting issues. So I think it's Stephen I'm handing over to for Public Health, is that right?
That's correct, Councillor. Yes, thank you.
Thank you.
So hopefully you can see my screen.
Yes, we can.
Yeah, we can. Yeah.
Excellent. Thank you. So thank you for inviting us along to the ward forum this evening. Just going to give a quick presentation on the Health and Wellbeing Board strategy for 2022 to 2030, creating a bolder, healthier city. So why have we got a Health and Wellbeing Board strategy? Well, that's a very good question. And hopefully if the slide will move on. There we go, technology. So the Public Health Department in the Council, we are responsible for protecting and improving the health and well-being of the population. We've also got specific responsibility for reducing health inequalities, i.e. the gap between those that are the richest and the poorest in the city. And the Health and Wellbeing Board is this place for political, clinical, professional and community leaders from across the care and health system to come together in Birmingham to improve the health and well-being of their local population and reduce these health inequalities. They've been in place since 2013. They're established through the Health and Social Care Act 2012. Let's get that right. And through the Health and Wellbeing Board, they work together with other organisations like the NHS to promote the integration of services, work together to improve health and wellbeing, and take these health inequalities that have been worsened, especially by the COVID-19 pandemic, and try and improve those, tackle those. So the strategy sets out, as it said, the Health and Wellbeing Board's ambitions for the next 8 years, 2022 to 2030, and it's based on a series of themes and cross-cutting approaches. How the strategy was developed. So creating a bolder, healthier city has been shaped and developed over the past 3 years, building on learning from the experiences from the Public Health 2019 Green Paper consultation, the Joint Strategy Needs Assessment, the Seldom Heard Voices focus groups, ethnographic research, and the insight surveys over 2020-2021. The delivery of this strategy will require leadership and action from the Health and Wellbeing Board sub-forums and partner groups. And the proposal is for the strategy to be a framework which signposts to action across the health and the care system. The vision is up there, and the board also recognises the importance of this framework in connecting with all the other stakeholders and their priorities, like the NHS integrated care system, the duty to address inequalities and responsibilities and strategies of the Police and Crime Commissioner, as well as all the public sectors, businesses, academia and community partners. And the vision is underpinned by it being citizen focused, consciously focused on reducing these inequalities, promoting equality and inclusion, and being evidence-based. So what is this strategy, proposed strategy that we're talking about? So hopefully I can get the next slide up and put it all into a nice picture. So this is the framework, and as you can see, it's got the 5 core themes across the top for action, covering wider determinants of health, protecting health promotion, health protection, and environmental public health. The 5 core themes run throughout the live courses, which is split into 3 stages across the bottom in the grey, and the strategy contains 2 cross-cutting approaches in the blue, which are present in all 5 of the core themes and the live course. And then closing the gap, you've got the pink circle, which runs throughout the entire strategy. So just breaking those down into a little bit more detail. So these 5 core themes that we've talked
Stephen,
about.
can I just ask a question here? You've
Yep,
got
sure.
mental well-being, etc. on the previous slide. Now, a lot of that for children certainly still sits with education. Is that going to sit with public health, the well-being? I don't mean mental health where it crosses that line, but is the well-being going to stay with education, or is that going to come into public health?
So mental well-being and balance. That's a very good question. Can I go? So up here, mental well-being and balance. So my understanding is that they'll work with all stakeholders, whether that's CAMS, and is it COOTH as well that you've got in Birmingham. I imagine they might draw into that. I don't think they're going to change. I mean, what it'll do, this it's got up on the screen there, mental wellness and balance will work with the creating a mentally healthy city forum. So I imagine that they'll be part of those different forums and they'll interact in that way.
Yeah, I'm just trying to understand where the decision making and the budget will sit.
That's a very good question. I can take that question back. What I'll do,
could you just email me when you've got an answer on it? That would be super. Thank you.
Yeah. Okay, no problem, Councillor. So these 5 core themes we've got here, 4 of them fit across in strategies and forums that are already in place. So yeah, so the framework, these 5 core themes, split into, we've already got the existing sub forums. The healthy and affordable food has the creating a healthy food city forum. The mental well-being and balance, I said, has got a creating a mentally healthy city forum. Active at every age and ability, creating an active city forum. They're contributing to a green and sustainable future. And then the protect and detect, which is the health protection forum. The Health and Wellbeing Board supports a through life approach, life course approach, and this is reflected in this framework, aligning with the Birmingham Solihull Integrated Care System outcomes framework, and the 3 areas it's split into is getting a best start in health, working and learning well, and aging well and dying well. As mentioned, the framework has incorporated the experience of response to the pandemic alongside the ongoing commitment to equality, diversity and inclusion. And the framework contains 2 cross-cutting approaches present in all 5 core themes and life course strands. So I've mentioned that the Birmingham Health and Wellbeing Board is committed to reducing these inequalities. The aim of the framework is to close the gaps and the inequalities at pace and scale across the city, which Health and Wellbeing Board forums will be tasked to demonstrate progress throughout the action plans. Closing the gaps section aims to address health inequalities linked to poverty, marginalisation and structural barriers and challenges. There's 5 key areas of inequality of focus, and they include inequalities based on deprivation, inequalities based on ethnic communities, those inequalities based on the wards, again, the inequalities between the inclusion groups like the homeless and the sex workers, and the inequalities affecting disabled people. So delivery of this strategy should explore these inequalities, and I've dedicated specific resources allocated to them, and an effort to addressing them and identifying clear evidence of significant gaps for people, with intention to close these gaps and improve the outcomes for all citizens in Birmingham. How are we going to measure the impact of this? So we measure the impact of the strategy over the next 5 to 10 years. The delivery groups will identify specific and measurable indicators that can be used in the short to medium term to track change and inform the delivery of the strategy. As you can see from the screen there, the indicators present in Birmingham presents Birmingham as significantly worse than the average in England. And just looking at the infant mortality rate, the rate there in Birmingham is not great. So there's lots of work for this Health Wellbeing Board to do, and we're hoping that this strategy will help us work towards that. So if you want to get involved with creating a bolder, healthier city, this draft strategy and the consultation can be found at the Be Heard website. So the link, I'll put the link into the chat, and also if you've got any questions on it about the strategy or the consultation, then there's an email there that you can access and ask any questions. So I've already got that one question from the councillor. Let me just close this presentation and I can see the screen, so if you've got any questions.
None from me, thank you.
But there's no members of the public on tonight, so there's no questions.
I did one 2 nights ago, and we had about 40 minutes of questions. So it's in one way it's nice that we've got no questions tonight. But the any questions that anyone does have out there,
you just got off easy. You won't say for next time.
Just I was going to say the email address is there. Please have a look at the strategy, have your input, have your say, and email the hwbstrategy@birmingham.gov.uk and pose your question to them, and they'll get back to you. And Councillor, could I just have that one question that you had again, and I'll make a note of it, and I'll get back to you on that.
Yeah, I want to know where Wellbeing is going to sit, because currently it sits under the schools to deliver and largely through BEP, but looking at those slides, it looks like PHE. I mean, technically it's not health because we're not talking about mental health, we're talking about that earlier piece.
So Wellbeing for children, where does that sit?
So where the decision making and budget will sit for that? Not necessarily where it will be implemented, but who makes the decisions for what will be done.
Decision making and budget.
Thank you.
No problem. Well, thank you for your time. I shall now leave you to get on with the meeting. Thank you.
Particularly through schools.
Yeah. Okay, Councillor, got that. Thank you.
So, Councillor Hodivala, I think is Ray still on the meeting? I invited Ray along tonight to see if there was an update. Hi, Ray.
Hello.
Hello. To give you a little update on the Commonwealth Games Community Fund. Well, basically to see if any applications have come in. John's off poorly at the moment, so if you've got any questions about the fund or about applications.
We haven't had any applications that I know of. I've tried to get hold of all the schools at least 3 times each and not had anybody even call me back.
Councillor, I'm aware of at least one organisation who might be interested in putting an application in. And I've asked them to go to the City Council website and speak to colleagues at Neighbourhood Development and Support Units. Now, whether that materialises into an application or not, I don't know.
Are you able to say who it is, Ray, please?
Yeah, sure. It was from colleagues at Compass Support who wanted to do some work around youth engagement and wrap some Commonwealth themed activities around young people.
Right.
No, I couldn't tell you any more than that. My role in this is to help facilitate kind of the ward forum discussion for any potential applicants. So if anybody does approach me and say, I've got a really good idea, my words are that you must follow the right process. It must go through the process that's been laid out. It's got to fit in with the ward plan, and you've got to have some engagement within the ward as well. So I'm aware of an applicant, but from my perspective, I have, in real terms, just pointed them in the right direction to the City Council portal. I couldn't comment on good, bad, or indifferent of the application. So that's where we are. Leslie, has John done a presentation?
I was going to say, I have a meeting with one of the sixth forms next week at the school, so I will ask them again, see if actually addressing it straight to the pupils has any more impact than through the teachers. So we'll see.
Yes, Ray, John has done a presentation.
Okay.
He's come twice to the meeting. Yeah, he has.
Cool. So my understanding for Reddicap ward, there is £14,300. So hopefully there will be a number of applicants where the allocation we can debate as a ward forum moving forwards.
And what's the closing date, Ray? Is it
the closing date will be the 30th of November for round 2. Round 1 is already closed. Round 2 will be the 30th of November. So I would be hoping that by the time we get to kind of the 30th of November, at least one, possibly a few more applicants will have applied to the ward to support Commonwealth Games.
Thanks, Ray. 30th of November.
It is 30th of November.
What is the website to direct people to again, please?
So it's the Birmingham City Council website. Thank you very much.
Easy to see it.
It is. If you just Google Birmingham City Council Commonwealth Games Celebrating Communities, it will take you to the right part.
Thank you.
Mel's just put it in the chat, Councillor.
Oh, thanks, Mel. 30th of November. Super. Thank you.
Okay. Is it on to the next item, Councillor, now? Any AOB or Urgent Matters?
Yes, we haven't got anybody here from... Carl's not here, is he, from Rhodes? Is anybody able to answer anything? Claire, are you able to answer anything on housing or communities? I've just got a query as to where the bins have got to in Falcon Lodge.
If you've got a question, I can take it back and find out for you.
Would you, Leslie, please? Yeah, we signed off some big wheelie bins to be provided for the flats quite a long time ago, and we're just wondering where they've got to, or if we can at least know, you know, even if it's 2 months off, what the expected delivery installation date would be for those, please.
What road's that? Did you say Carhampton?
Oh God, I think it was Carhampton, but I won't be held to that 100%. It's the only one I've signed off for bins for the flats in Falcon Lodge.
I'll get in touch with Les Williams and get him to email you.
Thanks ever so much.
Have you got any other queries you need dealing with that I can progress?
No, that's it at the moment. Everything is in hand, I think.
Okay, I'll email Les tonight to get in touch.
Thank you. Anybody got any queries for me?
No.
Oh, that was probably rather painless then, wasn't it? Thank you, everybody.
Okay, I'll stop the recording.
Have we got next date for the meeting just before we stop the recording?
I think we agreed on January or February. Yes. I know we have set 3 dates, but I'll confirm in an email.
We'll try and hold that in person, and we'll publish the date shortly, won't we?
Yeah. Where would you like to try me to get in person? I can start on that now.
The only place I can think of is St Chad's Church.
St Chad's. Okay.
Yeah.
I will try St Chad's if I start now.
Got half a shot.
Got half a shot, yeah. Okay, I'll do that. I'm sure it's February, the next meeting.
I think
And
you're right,
I'll
yeah.
confirm it in an email. Okay.
That's brilliant. Thanks, everybody.